I practiced in Tennessee and Memphis for about a year and a half before that. And I also had the master's in functional nutrition, which is why I'm able to talk about these things with everybody. Someone already asked you what's functional nutrition. What does functional nutrition mean? Now, functional nutrition is really how what we put into our body, how it coordinates in like how we function with that, what it gives us and what it gives us out in return. Yes, it works. Okay, so the first thing that we talk about in the way that the body functions is our central nervous system. So everything in our entire body comes from the brain, goes through the spinal cord, goes through the nerves, that affects the muscles and the organs, and that's how we function as humans. However, if you've heard, we talk about a lot is subluxations in the office, right? Subluxations are those things that creates an interference of that communication, which means that these are the levels where it can happen or we're not communicating correctly. We go from there. Subluxation, like I said, is any interference with the central nervous system that affects the communication of the nerves throughout the body. And this can happen in many different forms. So there are three things that cause subluxations. First is physical stress. All of the things that we go through in life. There's the mental stress, what we face, and then also chemical stress, which is really what we're talking about. Now in chiropractic, we call it 3 T's. Our traumas, our thoughts, and toxins. Today we're talking about toxins. Now, it's important to understand why I'm talking about the central nervous system, because if our brain isn't able to communicate to our body about what it needs to do, the detox isn't going to do anything and it's not going to function, it's not going to work. If we're not able to digest food, you say we're constipated, the detox isn't going to help very much. We need to make sure our body is communicating correctly in order for our body to function properly so we can actually do these things we want to do. Okay, so here, as you can see, if there's a subluxation between the brain and the spinal cord, there's an issue. There's a subluxation between the spinal cord and the nerves, there's an issue. If there's a subluxation on the nerves going to the muscle, there's an issue. So we want clear communication between all of them in order for this to be proper, in order for it to work. Now, why is a detox important, right? What we're gonna talk about today was the toxins. If you've been to our other workshops, we talked about the traumas. We're gonna have ones in the future that talk about thoughts and mental health. Now, what is a detox? A detox is going to be a regimen of treatment intended to remove toxins and really impurities from the body, okay? That's what most people think that a detox is. Now, our body is always detoxing, regardless of if we want it to or not. It's always trying to remove bad things. That's what, why we use the bathroom. That's why we breathe. That's why we sweat. And those are things that we're really going to talk about. Now, this is where I want really people to pay attention is a detox right for me? Should I even do a detox? Now, first thing we're going to talk about is, are you healthy enough for your detox? Can your body handle it? Okay, that's the first question that you should always ask is this right for me? Now, if we know it's right for you, we need to talk about who shouldn't actually do a detox. Now, pregnant and breastfeeding women, okay, you shouldn't deprive yourself from calories or anything if you're producing life. History of eating disorders, if someone has anemia or is bulimic, they already have enough issues going on. Don't try to calorie count or do these things. Other professions are for that. From here, people with chronic health conditions like diabetes, heart disease, kidney issues, liver issues, there are other things that you can do besides really restricting calories or going through a juice cleanse that are healthier and better for you where you're not going to have those issues, like we were talking about. People with weakened immune systems, children, adolescents, older adults, certain medications will have an effect. And then also we talk about gastrointestinal issues. Like I said, if you're constipated and you're not working well, that's going to be an issue also. And then we talk about being underweight or malnourished. Now we move forward from here. What are our goals? So it was really important to understand, what are you looking to get out of a detox? What are you looking for, right? Most people are looking for these things. Weight loss. That's the number one I hear all the time. I want to lose weight. And I'm like, why do you want to lose weight? Well, I want to look good. And I'm like, that's great. However, if that is your only goal, you'll get to it, but then you'll lose it again. You'll get to it, you'll lose it again. You'll get to it, and you'll lose it again, okay? Or better digestion. Some people I just want to function better, which is a really good one. Or increasing your energy, your mental clarity. A lot of people come in with a lot of brain fog, overall health, and skin health as well. Now when we move forward, what is a detox? And then what could be the best for those goals? So which one should you choose based off of those? Here, how to detox. Now, the body, like I said, detox is normal. It's always in a process of detox. The liver has a huge function in detox, and then also the digestive system has a huge function in detox. So how does this really happen? Now, the first thing that it does, we got to talk about the liver, okay? The liver, what it does is it creates something called free radicals, which is kind of dangerous for our body. We don't want free radicals in our body. It's kind of a harmful substance, but it creates that because we have all of these toxins. All of our toxins are stored in fat. So when we talk about, if we have like a larger circumference or we're obese or these things, we're gonna have more toxins. If we drink more alcohol consistently, more toxins. If we're smoking cigarettes, more toxins. If we work at a chemical plant or breathing in a lot of pollution, no, we're in Houston. We have toxins. Now, when we talk about that, when we talk about toxins, what's gonna happen is just the liver is going to change those molecules that are toxic. And it's going to put something on, whether it's sulfur or anything like that, something that's water soluble so that we can excrete it, okay? And that's where digestive system comes into play, that's where sweating comes into play, and that's what we're really gonna talk about. So, that best healthy ways how the body normally detoxes without us doing anything about it is hydrating and drinking water. Drinking a lot of water is very helpful. Half your body weight in ounces every single day is what is recommended, okay? Eating a whole nutrient-dense food. So, if you look at our grocery stores that tell people, if you look at a label and it looks like you're taking an organic chemistry class, don't eat it. Okay, if you can't pronounce it, it's probably not the best thing for you. If it has yellow dyes or red dyes or all these dyes in it, technically not good for you. It's going to have an effect on your system. Supporting the liver. This is where it's garlic, beets, turmeric, and green tea. I bought the pea salad for a specific reason. No one got it. So we have things that are very, very helpful, yeah, but at the same time, we're not doing them. Even if we know what to do, even if we know what to do, we're necessarily not grabbing those things. So when we're trying to support the liver, garlic, beets, turmeric, and green tea in moderation. You can't just do that only and expect to get healthy. Now, Caesar salad and a beet salad.
Somebody got a beet salad.
Someone got the bees. No, I'm just happy you got bees. For here, exercising, getting moving, sweating. Sweating is really, really good for detoxing the body, getting good sleep, and practicing mindfulness and stress reduction. Now, the benefits of a detox. I'm going to run through a little bit for you. So benefits: increasing energy, better sleep, weight loss, fair skin, improved mental clarity, better digestion, immune system's better, and it reducing inflammation. But if you look on the other side, they have some of the same things, but it's the opposite. This is why people are so confused when it comes to nutrition, because you can have a benefit from doing one thing, but it also can have the adverse effect and be not a benefit for you. And that's really what we're going to discuss. Now, there are different types of detoxes that we're talking about. I'm focusing on a simple 5 today, okay? Juicing is really the biggest one that people are like, oh, I'm gonna go on a 7-day juice cleanse and I'm gonna be great afterwards, and it doesn't really work. You might lose a couple pounds, you might feel like energetic, but then you go right back into it and you are ravishly hungry and everything comes back. Number 2, fasting or intermittent fasting. 3, an elimination diet. That's considered a detox. You're detoxing your body from certain things. And then also supplements and shakes. And then sweating or using a sauna. Now, first we're going to talk about a juice cleanse. A juice cleanse is a short-term detox diet that involves only consuming juice from really vegetables or fruits. It's usually examples of it are raw juice, here cold, soju, the things you've seen in the store about like, oh, what they're producing or they're selling, they're like, do this, and they push hard. They're like, we're really, really healthy. There's only a couple of ingredients in there. But then you look on it and you're like, you're lying. There's a lot of ingredients in here. They add a lot of sugars into that area. If you're going to do a juice cleanse, I definitely suggest juicing at home, buying a juicer. Some of them are really expensive. You don't have to have the expensive ones. I have the juicer at my house. It cost me like $100. I use it all the time and consistently. It is something that is so helpful if you just want, hey, sometimes I'll talk about juices where it's just like a celery and ginger juice. I drink a little shot of it every single morning with some cayenne. It's really good for inflammation and helping with the body. Now, when we talk about the benefits of it, it's really high in nutrients. So we're talking about vitamin C, vitamin D. You're getting a lot of those stuff and you're getting a lot of hydration with it as well. It will help with digestion. So you're usually not getting all of these things that you'll get from a juice cleanse because you're not eating as much fruit or enough vegetables. Most people go on a juice cleanse because they're like, I'm eating too much meat or I'm eating too much fast food and let's reset the body. And people are really excited about it, especially at the beginning of the year, which is why we're holding this now. Now, from here, it also aids in weight loss, which is most people's goals for doing a detox. But there are risks. So the risks for it are not for people with kidney issues or with diabetes. And the reason for that is because you're forcing the kidneys to work harder and work more. But if you're already having issues with it, like trying to deal with normal life, putting it under more stress is not going to be a good thing. Also, because of the diabetes, it's going to spike your blood sugar levels because when you talk about fruits, natural fruits have a lot of natural sugars in them. And it's not that it's a bad thing, but when you already have an issue with glucose levels, that's going to make it even harder for the body to respond. Then we talk about it being low in fiber and low in protein. You're not getting those hernivorous vegetables like broccoli and Brussels sprouts and asparagus that are really high in fiber, and fiber is meant for your body to digest. It increases the motility of the gastrointestinal system, so it allows you to poop better, right? Next, fasting. Now, I'm going to answer any questions we have at the end, okay? Now, fasting. I love fasting. I fast all the time. Now, there's two types of fasting. Fasting for long periods of time, which can be for religious purposes. It can be for, personal purposes. It can be for medical procedures that you're going to have. But we're talking about fasting in general now. It's the act of not eating or drinking for a period of time. So you can go through a water fast. Now, water fasting is the only thing you're doing is drinking water and you're not having food for a set period of day. It can be 3 days, 5 days, 7 days. You've probably seen some crazy things online where you've seen, I fasted and only drank water for 60 days. I do not recommend that, okay? I am not recommending that at all. Then we talk about dry fasting. Now, dry fasting is where you don't have anything. And we're talking no water, we're talking nothing that's going into your body. I don't recommend that either because I get thirsty and I'm like, please drink water. Please at least drink water, okay? It has no calories. I don't know what you're doing. I don't know why you're doing it, but please drink water. And then extended fasting is where you go past 3 or 5 days. You're talking about a week fasting, 2 weeks fasting. That's where it's like really, if you don't know what you're doing with it, please don't do it. Now, benefits are it activates autophagy. Anybody know what that? Autophagy.
It's like your cells eating the bad cells or the thing with God.
Yeah, it's autoconsumption. And so what it is it means that your body, once it gets to a certain point where it has no more energy to run off of, it's like, okay, I'm gonna eat this, I'm gonna eat this, and what does it attack? Its bad cells first. So they found studies that say with certain people that are going through fasting processes can help fight cancer because it's actually autophaging. You're eating those cells and destroying those bad cells. But at the same time, I'm not saying that fasting is going to cure cancer, okay? That is not what I'm saying. I'm saying studies show that it's taking those bad cells that are in the body that we don't want, that's helping with that. Also, drops the insulin levels. Well, of course, you're not putting glucose in the body. It's going to drop those levels. You're going to have weight loss because you're not putting calories into the body. It will improve metabolism because your digestive system's not having to work as hard, so it's easier for that to happen. And then better brain function because you get to a certain point where it's like, okay, the brain's like, what are we doing? We're not eating, we need to survive. There's something wrong. And the brain will flip a switch and say, we need more mental clarity in order to survive. That doesn't mean it's a good thing, okay? The risks, mood swings and irritable. Do you ever get hangry? So when we're talking about, then you'll get headaches because the brain's like, okay, I need energy. For it being one of the smallest things, only like 2 to 5 pounds, depending on person, but it consumes 20 to 25% of our energy. It is greeny, but it's processing everything all the time, and it's the most important thing in our entire body. And then you'll get low energy because you have calories. Moving forward from there, this is where I approve. Okay, intermittent fasting. I do this all the time consistently. If you're my patient, I do this, okay? Now, a structured eating pattern that alternates from periods of eating and periods of fasting. Okay, there are many different methods for this. First, 16-8 means where you don't eat for 16 hours and you only eat for 8 hours. I do this consistently. I almost do this daily. I do this probably throughout the week, and then on weekends I have a little fun because you got to, mental health. So, whenever we talk about the 16-8 method, right, what I do is I eat probably 7 p.m. I don't eat until 1 the next day for lunch. I'll eat when I get home at 6, 7 again, and then I'll go through that. So with that process, what it does is it gives your body the chance in order for it to really digest food. You want to be able to digest food. We have been told being hungry is bad. Or whenever you're younger, who's been told, finish your plate or you're not getting up? Well, we gotta stop saying that. Also, why are dinner plates getting bigger? Like, they're not that big. I remember going over to my grandmother's house all the time, and she'd give me like this plate, and it was a normal dinner plate, but now it looks like this petite little bitty thing that you might drink tea off of. You know, but they changed so much, and what that's done is the food industry, especially the diet industry, is over $1 billion industry where they're like, yeah, give them carbs, make them fat so they'll spend money to try to lose it. Okay? Now, when we look here, there's also the 5-2 method, which is calorie restrictions. You eat normal for 5 days, then you restrict your calories for 2 days. We're talking a hard restriction too. We're talking like 500, 600 calories a day. I don't want to send my body through that. That sounds miserable because once I get to a point and how do I put this? I like common things. I went doing the same thing every single day. Patterns, I guess. That is not a pattern that I think I could stick with. And then the eat, stop, eat means you eat regularly, then you don't eat for a whole day, then you eat again, and then you don't eat for a whole day, or you eat and then you don't eat for 2 days, and that's too chaotic. So I like something where it's like a system. I like a system. There was a study done in 2023 of 209 people, okay, done by Nature, which is a really scientific journal, if anyone knows what that is. And so they found that intermittent fasting for 3 days a week can reduce the risk of type 2 diabetes by increasing your insulin sensitivity. So these are things that to start now while we're not having these issues, to have a better future and improve quality of life for us. Now, intermittent fasting, of course, I'm going to talk about the risk and the benefits of everything. The benefits of it, and it promotes blood sugar control because it's okay to be hungry. If you think about how we evolved, or like whenever we were hunters and gatherers, we didn't just have food laying around. You didn't walk outside and there's a McDonald's, oh cool, let me get a Big Mac or some French fries. We had to hunt and find our food. And so if you didn't hunt or you didn't find it, you didn't eat. And so hunger is something that drives us, that sends us into hey, I need to go get this. Hey, I need to do this. But it allows the time for the digestive system in order to calm down, and that's what intermittent fasting is allowing us to do. It decreases inflammation. And the reason for that is because, again, it gives the body a break. It's not just shoving glucose into the cells consistently all the time. From there, it decreases blood sugar and cholesterol. It increases brain function and health. It helps with weight loss, and it improves metabolism. But the risks, you're hunger. I don't really consider hunger a risk. I try to tell my patients being hungry is okay. It's not a problem. It's because someday you don't have to eat immediately, okay? From there, low energy. If you're not used to it, sometimes you're gonna be a little tired. You'll hit that point where it's like, man, I'm a little sluggish, but then you get like a second burst of energy. That's kind of back low energy, and headaches are possible if you're not used to it as well. Now, when we talk about the elimination diet, it's taking something out of your diet that you normally have in order to feel better and eat better. So it's eliminating certain ingredients or substances that you probably already know you shouldn't have or you're having too much of, and that's what we're changing. So really sugars, carbs, alcohol, soda, going meatless, removing veggies, all those sorts of things, even energy drinks. So taking something away from your diet. The benefits are to break a bad habit. Whoever, like during holidays, who drinks too much? Yeah, we tend to. We're around family, we do that. It's a celebration time, and that's where that tends to happen. Who says, oh my God, I'm gonna stop drinking too many energy drinks, or I'm gonna cut down on caffeine, or okay, I'm gonna go carnivore and I'm only gonna eat meat to lose some weight. These are like the diets that are vegan or whole-based food. All of those things are really focusing on more elimination diet. So it's gonna help with weight loss depending on what you're doing. You're gonna have more energy and you're gonna be able to think clear depending on which one that you're doing. Now, from there are risks, okay? For one, breaking an addiction is really hard, okay? It is so difficult because our body produces dopamine whenever we do something that we like. And when we take that dopamine from it, we need to find something else that also gives us dopamine, but is healthier for us, okay? I tell people a lot who smoke cigarettes. Let's take it for example. Patients that come in and smoke cigarettes and they're like, yeah, it's just a really hard thing to break. I'm like, okay, every time you want to take the smoke break or anything like that, go for a walk. do something, go outside and go for a walk, get some fresh air and everything. When you're freezing your butt up out there, you're like, dang, I don't want this super right now, I'll go back inside. Those things tend to work. You can't just pull something out cold turkey and expect it to be like gone. You have to replace it with something positive that makes you feel better. Instead of these short dopamine hits, we need something that's longer lasting to make us feel better. From there, loss of energy, and you'll get irritable because, of course, you're trying to break addiction usually when you do an elimination diet, but it's also to take something harmful away. Supplements and shakes. This is another big one. A lot of people will go to the store and they will go to a box office. Say we go to HEB, okay? Go to HEB and you're like, okay, vitamin C, I need vitamin D, I need vitamin E, I need zinc, I need magnesium, I need calcium. Oh wait, they got this, they got that. And there's just a plethora of like a basket full of all of these supplements. But what are they actually doing? Right? When we talk about supplements, it is more important with supplements about what brand that you get rather than what you're actually taking, okay? Because whenever we talk about what people are taking it is fine. Supplements are great. They help a lot. However, whenever you buy it from box office stores like Kroger or HEB or Walmart, a lot of the time, those aren't the active chemicals of it. It's just kind of thrown over there and it's gonna be like, you're just gonna excrete it and you're not actually getting what you need from it. So I have a couple of brands that I tell people to buy from. The brands that I recommend are usually Standard Process, Pure Encapsulations, and a brand called Heart and Soil. Now, Heart and Soil is all going to be like from like actual cattle or meat produce and all of that kind of stuff. So we're talking beef liver and those sorts of places. That's a really good place to get it from. Standard Process they have everything that you need from there. Pure Encapsulations is really, really good as well. Now, when we talk about shakes can be really, really helpful, but can also be harmful to an extent as well. So when we talk about shakes, it's like taking healthy ingredients. It can be leafy greens, it can be these things, but most people are thinking shakes of like, okay, a protein shake or a protein mix, and that's really good for people who are elderly and aren't consuming enough calories and getting to that kind of stage. Now, whenever we talk about, you probably heard of Slim Fast, right? Slim Fast is something that's really popular, equate those sorts of things. But there are other things like Heal. There's also like just regular meal replacement shakes. Now, when we talk about meal replacement shakes as being a detox, it's not necessarily considered, oh, I'm detoxing away from something, but it's more of like, hey, I'm putting something into my body that I need to help me with this, okay? Now, supplements, the benefits and the risks. I want to talk about supplements more than anything because I think that this will be more helpful for most people here. When we talk about supplements, okay, milk thistle, dandelion root, and turmeric are really good for liver and kidney function, okay? So the liver is very important for detoxing. The liver helps us where it, like I said, produces those free radicals, then makes them water soluble, pushes them out through, the kidney functions through it, and it leaves through our digestive system, whether it's through pooping or peeing, okay? Now, with that, that's why it's so important for that. Now, activated charcoal is a binding agent, so it kind of takes chemicals. If you've ever, I'm a doctor, so I hear all these things all the time. So whenever you get people who say someone overdoses on something, they'll put activated charcoal into the body to bind it so it can be exited from the body better. Then when we talk about probiotics or prebiotics, those are something great to help with the digestive system. Before and afterhand, you find yogurts a lot of the time, it can be really helpful for just getting body into a better shape. Now, last one we're going to talk about is sauna and sweating. I'm going to take a little incredible time. Is it? No time.
109, sorry.
Oh, really quick. Cool. Okay. So, for saunas and sweating. Now, whenever we talk about sweating, I have to be very careful because dehydration is a big thing, okay? And also, like, heat stroke are very common. We're in Texas. It gets really, really hot. And so I want to be very clear that going out and just sitting in a sauna in order to detox, that you're drinking water afterwards. Okay, I don't want to hear you fainted. I don't want to hear that you like walked out, you're lightheaded. That is not what this is for. And so when I talk about detox, I'm not saying this is the only thing to do. This is the way that you should go. You should only go to a sauna or sweat. You should only juice cleanse. There's a multiple of things that you can do in order to help with this. Now, it is a popular method. A lot of people will do this after working out because they'll go in and they'll sit in a sauna for 20 minutes and they're like, man, it burns like 300, 400 extra calories, which is great. But then they're exhausted afterwards. That is not what I am suggesting. So when I already kind of talked about risks for it, are heat exhaustion, heat stroke, dehydration. It is not a replacement for healthy habits. So you can't just go to McDonald's or Whataburger, order all these burgers, eat it, and then expect to go into a sauna, sit there, and sweat out a burger. First, don't do that to the people in there. It's going to be like going to Fogo de Chao and just having lead sweats, okay? That's not a good thing. It is not a good smell. However, a sauna can be very helpful, but what I suggest for people, instead of, if you're not really into like the gym scene and going or have access to a sauna, just going outside and walking. Correcting these bad habits are something that is even better than anything.
Now, Hurtig,
Yes, sir.
is it fair to say that you still drink water while you're sweating?
100% you should.
Yeah, because the sweating still, it's functioning the way it's supposed to, and you don't dehydrate as fast.
Correct. So when we talk about sweating is the process of sweating or perspiring is getting toxins out of the body. Like we have so many toxins that are in our fat cells and in our body, so sweating is actually removing that. You ever get to a point where you like sweat really, really hard, but you feel so good afterwards? You might feel a little nasty because they're sweating, but at the same time, your body feels good. You feel lighter. That's because toxins have been removed from the body. Now, our world affects us every single day, all the time. Like I said, we're just talking about toxins today. In chiropractic, we really talk about traumas, about getting adjustments. All of you are in this room because you've been adjusted before and you're here into our clinic. Okay, we really want to focus on the forms of chiropractic, on why it's so important. Now, but other than just coming in and getting adjusted, what else are we doing about this? We really got to encourage our patients not only just to, hey, come and see us, make your appointment sometime, we're getting adjusted. That can't be the only healthy thing that we're doing. Because if that's the only healthy thing that we're doing, no one's really taking accountable for their own health. You're expecting other people to do it, and you're not going to get to that place that you really want to be. That place of health and longevity and increasing quality of life and playing with grandkids until you're 95, like those sorts of things. That is all what we want. But if we don't do the things now that we need to, we're never really going to get to that close. Now, removing the interference today and living for a better tomorrow. Now, interference can be with anything. Like I said, interference are subluxations, eating horrible diets, going and weekend warriors, you know, they might go to the gym all the time. They might sweat these things out. That doesn't mean they're healthy. They might look healthy, but inside doesn't always reflect what's outside. So my main purpose of this entire workshop is kind of this last part. I wanted to have enough time to answer any questions that y'all have. All of this was a lot of information, but I want to know kind of where you are in order to kind of specifically specialize it to you a little bit more. So, anybody have any questions? Yes.
Can you flip back to the supplement slide?
Yeah, we
Stuff like
see
that.
the branded brands that you stand up in.
Yeah. Standard process, pure encapsulations, and heart to soy.
Is there one that you think more over the other?
It depends. Standard process of pure encapsulations where I'll get most of my stuff. It just depends on price and tax, because sometimes it's like, hey, we can only buy 300 or you can buy 50. It depends on how much I want of that thing, depending on where I buy it from. But I trust both brands really, really well.
What's the hardened soil?
Hardened soil, pure encapsulations, and standard process.
Pure encapsulation. What were the three that you mentioned that really help our kidneys? Milk thistle, dandelion root, and activated charcoal.
Turmeric. Yeah, turmeric. Activates charcoal is a binding agent. And so that's if, like, you know, we know that we put something into our body that we necessarily shouldn't have, or, you know, a lot of people will brush their teeth with like charcoal and that kind of stuff. That's because it's trying to remove those toxins and those chemicals or stains.
So adding those combined the turmeric and all that creates a charcoal. Is that what you're saying?
No.
Oh, okay.
No. So whenever it is talk about So these are all different. So
Okay.
thistle is a different thing, and these are all like supplements. You can get a McThistle supplement, dandelion root supplement.
Or take it one or the other, as you were saying, not all together.
Yeah, I wouldn't suggest. I mean, you can. They have other health benefits as well, and you can take those. But don't be like, oh my God, I need to put everything in my liver. That's going to make your liver work too hard when it hasn't done so in the past.
Because I'm familiar with the roasted dandelion root.
Root it, drink it, and over. We'll do
Medicine.
So what compounds are in those things that help flush out the toxins or free radicals?
Yeah, and so whenever we talk about turmeric is really, really good for inflammation. And so whenever we take it, it has that process in the body that it's water soluble. And so it'll attach onto these free radicals and it'll allow them to excrete a little bit more easier. And also it's taking the inflammation out of our bodies and it's just allowing us to feel better. None of this is like a one quick fix rule. That doesn't exist. And whenever we're looking for that, it's not possible. A lot of people think that surgery is a quick fix deal. I see more people with surgery than people without nowadays. Yes.
Thank you, doctor. So sauna, I sauna 3 to 4 days a week because there was a certain study that came out that said it helps with dementia, it helps with Alzheimer's. It does heal your organs on the inside and it allows all that. But when I know I'm going to sauna, I hydrate the night before, instead of just trying to get it all in after the sauna. What do you think about sauna, and have you heard any other updated news besides the detox part?
Yeah, so I think your question is more geared towards the ailments like being preventative for Alzheimer's or preventative for dementia. There's a lot of studies where it says, yeah, the sauna helps, but what if we talk about that condition specifically? Now, our brain is composed of mostly fat. And if we're not putting the correct oils into our brain, that's where we start to have issues in the future with memory loss based off of Alzheimer's or dementia. So what I suggest for people who are looking for, if it's preventative, a lot of fishes are good, really like salmons. If you're allergic to fish, or omega-3s are really, really good for it. Also, there is a study that was actually done of 90,000 people that if you take 1 tablespoon of extra virgin olive oil, you have a 28% decrease of developing Alzheimer's or developing dementia as well. That's olive. Yeah, extra virgin olive oil is the only thing that I cook with, or coconut oil. If you do vegetable oil, Crisco, or anything like that, please throw it in the trash. It's all.
What about cod liver oil?
Cod liver oil? Yeah, so that's pretty much the same thing as an omega-3 or fish oil. So that's helping with like the omega-3s and everything, getting a lot of fat storage in the brain, which is what functions off of and how our nerves like communicate quicker. Yes.
What's the main cause of Parkinson's?
So that is still really to be. It is connectivity of the brain. That is a bit out of my scope of practice. And so when I talk about Parkinson's, and I couldn't give you that necessarily information. So if I would get up here and babble to you, I'd probably be telling you lies, and I don't want to do that. Yeah.
Yes. Doctor, with your expertise in nutrition, so can a patient like myself come here and just to see you on nutrition with my
So
insurance?
I do not do nutrition counseling.
Okay.
I talk to my patients if they have questions over it, but I do not do anything nutritional specific here into the clinic. Yeah, you have a question, yes.
I have 2 questions. One, taking the juice cleanses, and then the other on number of times to detox per year, recommendation wise. For juice cleanses, I've done getting introduced to juice cleanses. It's recommended to start with a 1-day juice cleanse, and then if you want to take the needle up from there, then a 3-day juice cleanse and a 5-day juice cleanse. But when I was initially doing these, it was all like segueing into switching to a keto/intermittent lifestyle fasting. So a lot of people questioned or would kind of challenge the juice cleanse detox entire theory and say, oh, that's just all hype, or actually it's not proven. And like you said, there's a lot of sugars and juices that are sold by like little stores instead of us juicing at home. So, or as far as your experience goes in Houston or wherever else you've lived, when it comes to juices that you buy from like a juice store, whether it's Juice Well, Earthcraft, Revolution, or Pressed Juicery, any of those places. Yay, nay, do they have?
A lot better
Okay.
what we're getting from like grocery stores. So a lot better than like ordering online or anything like that. Like there is a place, because I practiced in Memphis for a year and a half. There's this little trailer like a taco truck, but it was like a place called Raw Girls. And all they did was like they would like cold press juices. Absolutely delicious. But what they're using is you can ask them, you can go to these places to be like, hey, are you using like organic grass-fed type of things like in these areas? Because when we start talking about pesticides in our food, that is a whole another conversation. I try to buy mostly organic, but sometimes it is ridiculously expensive. So I go to farmers markets. If you want to go to a farmers market, please talk to Tom. So farmers markets are absolutely wonderful. It is fresh produce. They're picking it in their own gardens. Is it a little bit more expensive? Yes. Is it worth it? 1,000,000%. You can go there, buy fresh kale and fresh celery and do all these things, the beets, and juice them at home yourself. It is a lot more cost effective. It just takes a little bit more time.
Yeah.
And so when I tell people, hey, take the time to do this, I'm not saying taking time, I'm saying carve time out. Yeah. You have to make it a priority. Now, second question was,
As far as number of times to detox pre-clear wellness, like
the study showed that at least 2. It is usually spring and fall. It's usually going from one area. A lot of people like to do it at the beginning of the year because New Year's resolutions. But with New Year's resolutions, how many people actually stick with them? Gyms are so busy in January and February, and by the time you get to like August, it's like, oh, this is nice. You know what I mean? And so that's where that is. And so what I suggest is really a spring and a fall once we're going from, but the reason for that is because our bodies still respond to the changes in produce that is like actually grown at that time. Our bodies haven't evolved past the point that many people think that we do. Like our bodies have not handled technology well. Let me tell you, it is wonderful, but at the same time, it is awful for us. Even like this, the humps and everything that are coming from it. But it's the evolution of it. That's spring and fall. Once we're transferring from one season to the next is really the best times to do it because it invigorates our bodies to switch to a certain type of.
how come spring and fall as opposed to summer, winter?
I guess it could be the same thing. It's just what the studies really show. And so I would just pick 2 that are like separate in those things, keeping it probably 6 months apart. Half a year is really where it says.
Is it recommended to do like spring, fall, summer, winter in that kind of time apart? Or like what if you did spring, winter?
No.
Any benefits, like pros and cons, spacing it out longer, most wearing closer?
I'm aware. And the reason that people are like, oh, start a juice cleanse first before you go to this type of diet, it's trying to shock the body. It's trying to like change the body with what your diet is. Because if you go into something and you completely change it and then you introduce food, you have a better probability of sticking with that. Now, if we're talking about diets, I've done a diet, like a nutrition actual like seminar or workshop like we're doing now. The best one forward, Mediterranean all the way.
Yeah.
Yeah.
I could add a little bit. If there's a dead season for fresh produce in this area, it's summertime. Oh, and you can get melons. And watermelon's the next, but it's the next diuretic. So if you're sick of drinking water, just eat a big slice of watermelon. Yeah. That does the same thing. But you can get like okra all summer long. It can't be too hot for okra unless you're in Archer or something.
Yeah, and then we also like talking about fiber. It's really coniferous vegetables like Brussels sprouts, broccoli, asparagus. All of those things are great for increasing motility of the digestive system.
Almost all that stuff is late fall, or spring stuff. By May, most of that stuff's gone.
May I ask you a question about farmers market? Yeah. If I see a sticker on an apple, is that you know how you have those stickers like in the grocery store? So at the farmers market, they have stickers and stuff. And I'm like, is that suspect? Like, did they go through some other type of process that we don't know about?
Well, other vendors that sell at the market that I sell at, you don't have no stickers that fairies has.
Okay, yeah, because I thought that was suspect to go to a farmer's market and have stickers. Like it would be a grocery store type.
Yeah.
You know what it said on the sticker?
You know those stickers, those outdoors and stuff, those codes. I would think you wouldn't have that at a farmer's market because it should be coming straighter.
I mean, it's possible that they have at their farm the equipment to put those news on there.
Right. Like if they had a brand, is why I asked. Like,
No, there's codes for each.
Yeah, when they have sometimes I would suggest what they did is they probably have their own shop where they sell produce. And what they did is they bought it from a larger company that does that, and then they just took it to the farmer's market in order to sell it very well. And so same thing as buying it from a grocery store and not actually farmer's market. That's the right. Yeah, yeah. Any other questions?
So if you live in this area and you're interested in a farmer's market,
Right now.
Memorial Village's farmer's market, it's off of Einhorn and
Yeah, they're very good. You have organic and then we just have fresh.
yeah. They also have food vendors there too if you need it.
It's called
Memorial Village.
It's on Bianmore.
Yeah. So at that church, that's right.
Urban Harvest Saturday morning, West Time Room, Buffalo Speedway.
Yeah, that's a big one. That's a really, really true partner's market.
It's right across St. John's.
Yes. So it's over there. It's off of Buffalo Speedway at West Time.
Yeah, you could park in the garage at St. Louis Methodist. It's in the parking lot right there on the corner.
Yeah. There's also
And Bus Tower.
there's also a massive one that's there year round. Where's Deuce Bay Farmers Market? It's in the Heights, right off. Really.
On Airlines.
That's where it is. Yeah. So I've been there a few times. It's really, really good as well. I definitely suggest please just break captions so much.
Yeah. Thank you.
Anything else about time growth they shut down?
Okay, so juice cleanses. Yes, the Hybrial.
Like I said, it is very beneficial, especially you're healthy, your age. Something that I would recommend, yeah, go for it. But it's to shop the system to turn from doing one thing to the next thing. So it's not you. Like, invest to juice it out. Doing the other juices, yeah, they're fine. But you also don't know exactly what they're throwing into it. There's going to be, they have to ship it. And so in order for a juice to stay long, yeah, you can put it in the fridge. But how long is juice? Have you ever juiced it yourself? Put something in the fridge and it's like 3 days, it tastes differently. It took more than 3 days in order to get from that warehouse to us. Why does it still taste fine? That's what chemicals in it. Okay, and so that's where I'm like, yeah, there's something in that. That's why I'm saying juicing at home, you know what you're putting into it, you know what's going on.
a super serious question. So if you based your juice cleanse on the season, and you want to, start one in the spring, would you change your behavior depending on if the groundhog sees its shadow?
Great question.
They need it.
Now, in order for any of these detoxes to work, how I started this whole workshop was the central nervous system. The central nervous system, if our brain is not connecting correctly and we are not able to, communicate from the brain to the rest of the body, none of this else is really working. If our digestive system isn't working, how are we supposed to detox? If we have, say, eczema or all these issues with our skin, how are we supposed to expect sweating to work? We need to handle first how our body is functioning properly and then moving forward into these other things. Okay, so that's why we talk about the FUTs in chiropractic, the traumas, the toxins, the thoughts. Okay? Now, Carly has cards for everybody in order to, if you want to give them to anybody you love, do you consider chiropractic like giving the gift of chiropractic? Okay, it's an act of kindness. You've seen the way that it affects our lives and how much better that you've been, but you see other people around that you love and they're like, hey, let's do something different. I want you to be healthy. I want you to be around. But allowing them to come in and get checked out for free is the best gift that you could ever give to anybody. So I definitely recommend taking it. And you can't force anybody to come in, but you can take that first step and let them know that, hey, this is actually where health is supposed to be, not like, oh my God, I'm going to have surgery in the future. If you can prevent people from having surgery in the future, that is amazing. Even if it's just one person. Yes.
Yes, I did. I forced my mother out to chiropractic. Yeah.
How if you're like Paige?
I was playing with her about that sciatic nerve again, and I had the taxi come pick her up because she couldn't move or do anything, and yeah, she's
so much better. So she's been seeing her chiropractor. She lives in Oklahoma. Otherwise, I would have her come here. But yeah, I found a chiropractor in Oklahoma and made her go. Yeah.
Yes, Lord, this is the thing. Like we can only get cards for people that come to us. Other people, well, I'm the fourth chiropractor in my family. Okay, I have been raised around chiropractic. I have been adjusting since I was 5. I will forever be adjusted because it is the best thing that you could ever do for yourself. If you do anything else, which you should definitely do with things, but if you get adjusted, at least you're taking that step in order to be, I get adjusted once or twice a week. My job is really hard on me. I do this all day long. I'm always in a bad posture. Even if I try to have good posture and I'm going for adjustments, I'm doing this, I will forever get adjusted once or twice a week, depending on how far my week is. Now, when we talk to people about getting adjusted, sometimes it's a time thing, sometimes it's a money thing, sometimes it's this. But we take a look at your x-rays and based off, hey, where are we feeling? How are we feeling? But if you're coming to the office, you're like, man, my low back is really, really hurting today. It's hurt you for a week. You waited too long to get adjusted. Your body already has a subluxation and it's already affecting the way that you're functioning properly, and that is not okay. Yes.
More comments and questions, but when you said that you get adjusted 1 to 2 times a week, I am firmly a believer that chiropractic is a lifestyle choice. So if you care to, stay nimble or like just in good physical condition later on, start sooner than later. And I agree with what you said about your job being hard, because even if you go get a massage anywhere, those masseuse people who are helping work out all of the tension in your bodies, it's like a transference of the tension in your body actually gets absorbed into their bodies, and then they are kind of removing the tension from you, but then it's building up all of the lactic acid in their muscles. So the masseuse actually have to go for their own maintenance.
Yeah, how many masseuses I see?
Yeah, I mean, it's
So many. Stylists.
Yeah,
It is.
there's a transference of that like toxin-filled body going from one to another. When someone's trying to work it out of your system, it gets absorbed by theirs, and then they have to come see chiropractors
We just see so many other doctors and professions. Okay, we see ER doctors and all these things, and they're like, man, I need your help. I need this. And then tell them, hey, this is what we need. Why so many appointments? Why are you doing this? I'm like, look, you need me. I will probably never need you unless I make it to an accident. And that's when we really start talking about things about like taking care of your health now is so important so you don't lose it again.